record this. And Dr. Cook, good morning. Thank you so much for joining me this morning.
Good morning.
I'm here with Dr. Kate Cook. And Dr. why don't you, I know you have a long title because you have a lot of job duties, but go ahead and share that with us.
So the easy answer, I'm a pediatric hospitalist, so I take care of kids who are admitted to the hospital, but I'm the medical director for inpatient pediatric medicine and school telehealth and the medical director for Norman Public Schools.
Awesome. And right before we went live, the harp just played behind you, so a baby was born this morning, right?
Yes. I think it's one of the coolest things that the hospital does is it kind of refocuses you and lets you know that wonderful things are still happening.
Absolutely. That's so cool. Well, really glad that you could join us today. We have a few things we want to talk about this morning. But to begin with, the Chamber was really excited to partner with the Hospital Foundation and also Cleveland County to try to acquire some of those personal protective equipment items that are needed. And so would you talk to us about that program and how we're doing and kind of what the needs are?
Absolutely. So in order to kind of centralize the need and make sure that everyone who needs things gets them in a efficient way, the donation center is at the Cleveland County Fairgrounds on Monday, Wednesday, and Friday. And so the Norman Regional Foundation on their website keeps a list of what our priorities are for needed items. And so just to kind of run through the list that's up right now, PAPR hoods, I don't know how many people have those laying around, but they're the hoods that go with our protective, like individualized air purification system. So if anyone has access to those would be wonderful. N95 masks, also KN95 masks that can also be approved for healthcare use. Surgical and isolation masks, which are medical grade. Temporal scanner thermometers. Mini tipped swabs. So this is something that maybe other doctors' offices may have, and especially if they're cutting back on which patients they're actually seeing in person, potentially that could be a much needed item because the swabs that we usually use for flu testing or other viral testing can be used for COVID testing. And so some of the roadblocks to COVID testing are, one, the testing kits themselves, which once we get those, we seem to run into another roadblock of needing the supplies to collect the tests and the PPE to protect the people who are collecting the tests. So once all those stars align, we can really ramp up the testing. And so these mini tipped swabs for viral testing are needed.
So is that a regular, I mean, that's different than just a regular Q-tip, is that right?
Right, yeah. I mean, it can't be a wooden stick. It has to be like the specific kind of swab for the viral testing.
Okay.
And then also the germicidal bleach wipes we are needing.
Gotcha. And also on the N95 mask and then the KN95 mask, what's the difference between those?
I don't know that I'm an expert to speak on that. My understanding is that KN95 is more industrial than medical, but they can be approved for medical use.
Gotcha.
Could be wrong about that, but that's what my take on it is.
Okay. And was there anything else on the list? I'm sorry, I may have interrupted you.
That was what was on there as of this morning.
Okay. And I know that there's been, over the last few weeks, there's been a lot of talk about the homemade mask. We're still needing those, right? Aren't you still requesting?
We are. And so it can be hard to know what the need is because the recommendations change so quickly. And so ideally, healthcare workers will only use medical grade protective equipment. The problem is that a lot of hospitals are running low on that and doing what they can to preserve that. And so looking for other ideas or ways to kind of protect everyone without using up the medical grade protective equipment. And so one option is to use cloth masks on people who are sick. The main benefit of cloth masks is to prevent spread. I think of it like it's easier to stop the water coming straight from the faucet or straight from the hose than it is to stay dry once it's spraying all over the place. And so the cloth mask, even though it doesn't have the filtration that will keep you safe from the tiniest little droplets or the tiniest particles of virus, it can protect everyone around you from the droplets that come out just when you cough or talk or breathe. And so the idea is if everyone's wearing a cloth mask, you're less likely to spread to other people. And there's a good percentage of people, around 25%, that are asymptomatic but still have the virus. So you may not have any indication at all that you're sick, and you could be spreading it to other people. So the best thing for the whole community is to try to prevent that spread.
Now, I love this idea that one, people are engaged, they're wanting to help out, so they're making those, the cloth mask. Also, I've seen some great videos with the plastic face shields that people are making.
Yes.
We're accepting those also, aren't we?
Well, I know that we have been. For some reason, it wasn't on the list that I just printed off this morning. But yes, those face shields help to protect. The layers of protection are what's very helpful. And so if you're wearing your N95 mask and goggles, and then a face shield can help protect that equipment as well. So it's just the second layer of protection.
I think maybe I think there's some people who are making those because I think they're a little unique and specific. So maybe just getting those supplies are needed. Now that was last week, and things continue to evolve quickly. I realize.
Yeah. I don't know I know I did see a post that Harbor Freight donated a lot of face shields to the hospital. So way to go, Harbor Freight. And that may be why it got maybe bumped down on the list for right now.
Gotcha. Okay, kudos. So if they're wanting to donate either an item that they have on their shelf, in a closet, in a house somewhere that a business has, they can drop all these things off at the county fairgrounds Monday, Wednesday, Friday from 3 to 5. And then they're being transferred to the hospital. We want to encourage people to stay away from the hospital unless you're there for healthcare reasons. And that's why we've created this site off campus so people don't have to worry about going to the hospital, right?
Right. And everybody wants to do the right thing. And so it's helpful to have instructions on how to do the right thing.
Yeah.
And the hospital is still asking for cloth masks. It just wasn't on the list of medical supplies that I had.
Okay, cool. And if you don't have any of these items at home, I know the foundation is accepting donations, and then you can designate your contribution, and that money will be spent for PPE.
Absolutely.
Okay, very cool. Well, now you're not unlike many physicians. You're a parent, you're working full time, you're trying to juggle and manage, work-life balance in the midst of a pandemic.
Right.
You have your workplace is certainly right at the tip of the spear, but maybe talk to us about what that experience is like and what recommendations you have for parents. I'm home, working from home. My wife's here. We have 4 kids, so we started yesterday the learning like every other normal public school parent in the city. But talk to us about that.
Well, thankfully, I'm married to a teacher, so I was able to say, this is your part of the household duty. So he's taken that on to help with the distance learning on the kids, which is a huge blessing. But it is incredibly hard to balance. You're doing the job of probably 4 different people: your childcare, the school, your own job that you're trying to do, and managing the household when there's people in it all the time. So I think it's unrealistic to expect anyone to perform at their peak level in any of those 4 jobs that you're trying to do currently. So give yourself some grace. It's not forever. This is a crisis mode. And so we're just trying to get through the crisis. And so as far as, from the perspective of a doctor mom, so I have 3 kids at home. I am obviously concerned about myself getting sick and not being able to care for my family and potentially bringing illness home to my family. Another huge obstacle is my parents are usually very involved with helping out with our kids. And so we've cut off all, physical contact with my parents. We're still trying to do, FaceTime calls and let the kids see them some, but that's been another big obstacle too, because obviously we want to protect those who are at biggest risk for more complications from getting infected. And so I know some physicians are just not going home to their family because of the fear that they would bring home infection. A lot of physicians are adopting this decontamination process where you basically change clothes before you even come in contact with your house or your family, get straight to the shower, everything goes straight in the laundry, try not to bring anything contaminated from the outside to the inside. A lot more hair washing than people are used to. So it's basically, the best we can do. I think it's a hard choice to make, of particularly, you may be contagious before you have symptoms. So it's hard to know at what point would you stop being around your family if you started having symptoms. So it's a hard decision to make for a lot of physician parents. But the good thing is that most kids that we're seeing who become infected are not as severely affected as adults are. I know that's not always the case, and particularly the outliers that we are hearing about, we've started to see some children who have died from it, and those really stand out because it's a huge fear that folks have, that their kids could become so severely ill. So while it's still a possibility, it's certainly not the norm for kids to get that sick. So I think that helps with making the decision that it's okay to still be around your family, but certainly it's a personal choice for everyone. That being said, sometimes it is nice to be able to actually get away from the house and go to work. It's tough. It's stressful for everyone involved. And so, it's a good time to keep your emotions in check, like to know what you're experiencing and reach out for help if you need it. I think we're compounding all the stress of the fear of the illness, the stress of trying to manage the household and education and work from home. And then we cut off all contact with your support system. So it's kind of a recipe for disaster. So definitely reach out to your support system when you can. It's okay to ask for help. I certainly have done that lately. It's a struggle.
So, and then we have a good number of people that are watching the video right now, and I just want to encourage them, if they have any questions, to please pose those before we wrap up our call here in a little bit. But so we're now 3 weeks or so into this pandemic as far as locally goes, from when there was action taken on a local level. How are we doing? I mean, are we making headway? What do you think?
I think it's hard to know based on Oklahoma's testing numbers, just because we really haven't expanded testing to the point that we need to get a good feel for what the disease is doing. But I think across the country, we're starting to see that the social distancing is paying off in some communities. So I think as much of a sacrifice as these efforts are, and obviously it's really impacting the economy greatly, we're saving lives. It's not the time to back off of that. It's working. And so the sacrifice is worth it.
So don't let up. I mean, now's not the time to let up. And I keep hearing on different news channels that, particularly in Oklahoma, this week and next week are really two important times. We could be at the peak somewhat. I mean, still yet to be determined, but that could, we're making headway, but there's still a lot of ground to be able to make up, right?
Definitely. It's still going to get worse before it gets better, but hopefully we can kind of knock the top off of that peak.
So I was on a call yesterday with some of my staff, and one of them said that she had to drop off to go do a virtual doctor's visit with another family member. And what a great opportunity we have right now, the healthcare system, to be able to virtually visit with our healthcare provider. I know that the hospital system has an app that you can do that. I know different insurance companies have that, but have you utilized that as a physician yet?
So I was part of the pilot program with Norman Public Schools over the last 2 years to do virtual visits with students at school. And so I think we were seeing the new frontier of virtual telehealth. And this pandemic has really just caused it to explode. So there will be a lot of kinks to work out. I think that this is just we're all shifting to telehealth, and it's going to stay this way even after the pandemic is done. But I think it does kind of bring to light the options that we have and what we're able to do well and what we're maybe not able to do as well through telemedicine. So it's definitely been a learning experience, and it's great right now to have a safer way to connect with your doctor.
Yeah. And so if besides telehealth, what advice do you give to somebody, and maybe they're not even experiencing COVID-19 symptom, but something else, they have another ache, pain, something of that nature. What do you give to folks about how they can access healthcare right now?
Yeah. So it's definitely uncharted waters as far as, things that you wouldn't have hesitated to go in to get checked out before. People are having second thoughts. And I think that's why we're seeing a lot of, ER visits decrease, which is great. We want to use the emergency rooms just for emergencies. But we're also seeing clinic visits decrease because people aren't sure what to do. So I think certainly if your symptoms are concerning at all for COVID or something else that would be contagious, the right thing to do is to call the clinic ahead of time to see what their process is, whether they're doing telehealth visits or some are doing visits in the parking lot to try to avoid exposure to the rest of the patients in clinic. I think we hesitate a little bit more than we would in the past, but certainly the big warning signs, if you're having trouble breathing, if you're not stay hydrated, those are big red flags that it's time to get checked out, particularly if these are, COVID type symptoms. So don't put it off too long because you're afraid of being exposed to something else at the doctor's office. There are ways to be seen.
Okay, very good. And testing right now, what's the testing process look like in Norman?
It is such a moving target right now. I've heard of certain clinics starting to do rapid testing, which I believe is probably rapid antibody testing. And it's just so much of this is brand new and we don't know, okay, so what does that mean? How long would that be protective? If you do have antibodies, does that mean that you won't get infected again? So it's hard to know. I know that the health department is offering some testing, but again, that changes daily on what's still available as far as the testing collection supplies and the protective equipment. Doctors' offices can still, certainly refer for testing either through private labs or the health department. So it's hard to have all that information current on a daily basis to know where you can get it.
Gotcha. Okay, very good. Well, is there anything else you want to share with our viewers right now before we close up?
I would just say, hang in there. It's not forever. We'll get through this.
I love that. Good advice. And you hit on the mental health aspect of where we're at. Tomorrow afternoon, we're going to be visiting with a couple of counselors here in Norman to talk about that and how we all need to be concerned about our mental health and how we can maybe address that in a really positive way as we get through this pandemic. So I would encourage people, if you're watching this today, tune in tomorrow afternoon to our next Facebook Live event with our local counselors and maybe learn some best practices about how we can all take care of not only our physical well-being, but our mental well-being also. Well, Dr. Cook, thank you so much for joining us today. We appreciate your expertise, and I hope that you would relay to your fellow healers at Norman Regional Health System how much we value and appreciate them. Again, we know you're at the tip of the spear. You are in the middle of the battle right now, and we greatly respect and appreciate you and your coworkers from the bottom up. Everybody in the whole system is just doing outstanding work, and I think we've seen a lot of care and admiration that's been shown across the community for folks like you and others. But I hope that you would relay our gratitude and appreciation. And thank you again for joining us today. We really appreciate it.
Thank you. It's my pleasure.
Okay, take care and be well.
You too.
Thanks.
Bye-bye.